On page 15, we start talking about over-the-counter medications. By far the most common medications taken by the average person in the United States. These are drugs that are sold all over the place, from gas stations to grocery stores, and are considered fairly safe to be taken by the average person if directions are followed. Now, over-the-counter meds are considered to be fairly low risk because they have been taken for usually a very long time. They have been tested, then they've been on the market as prescription drugs, and then when the patent has run out and other companies have been able to make these drugs, they are sold as over-the-counter drugs. So usually they have been taken for years and years and years. And if there are any kinks in these drugs, they usually are spotted because they've been taken so long. They tend to be at a lower dosage than a medication that's by prescription. For instance, when Motrin was a prescription drug, it usually was ordered in dosages of 600 to 800. When it was released as an over-the-counter drug, as ibuprofen, it's sold in tablets of 200. So you can still make the prescription dosage by taking 3 or 4 200 milligram tablets, but by themselves they're sort of a low dosage. Patients can buy this on their own as they see fit. It's important to remember that all medications may have chemicals that the patient is not really aware of that can interfere with other meds they're taking, and that there can be drug interactions. And we have a page where we talk about some hidden ingredients in some of the medications. Alcohol being the most common and can be very dangerous. If you want to take an over-the-counter med in the hospital, that's going to require a prescription or a drug order by the healthcare provider. As I said before, herbal medications have not been tested for safety and effectiveness, and so are not considered medications. They're considered supplements. But it's very important to always assess our patients for herbal medications because they too can interfere with medications that are taken. Many of the common cold medications are not recommended any longer for use in children because of past harm. So it's almost impossible, I'm told now, to find cold medications for children under 2. Used to be they had all kinds of infant cold medications. Now those have mostly been taken off the market because of adverse effects and problems with giving them to very young children. And even after the age of 2, it's recommended that you only use them with the guidelines of a physician. Many drugs now are sold behind the counter because of abuses with those particular drugs. One example being pseudoephedrine, which unfortunately was used to make methamphetamines, and so now us law-abiding folks have to go up and show our license and sign our lives away and talk to the usually very young person behind the counter about all of our prescription or our symptoms, signs and symptoms, so they get to hear all about our stuffed up nose and our itchy watery eyes before they'll let us sign out these meds. Now, when a medication order is written in the hospital or another facility, it has to have a lot of information on it, written out by the healthcare provider. In the state of Tennessee, prescriptions and drug orders can be written by doctors, advanced practice nurses like nurse practitioners, physician's assistants, and dentists. I don't include psychiatrists. Psychiatrists are medical doctors who have specialized in treatment of psychiatric disorders, so they're still MDs. But that's who are able to write prescriptions or orders. So regular nurses, registered nurses, and LPNs are not allowed to write prescriptions or medication orders. Required information includes the patient's full name, first and last, the particular date that the order is being written, the name of the medication, whether it's generic or trade name, the dosage, the frequency, how often that medication has to be taken, whether it's once a day, twice a day, 3 times a day. The duration, how long the patient will be taking that medication. The route of administration, is this IM, is it sub-Q, is it oral? And then the signature of the healthcare provider. Now that same information also has to be on the prescriptions that are either faxed from the healthcare provider's office or given on a paper to the patient and taken to the pharmacy. Excuse my barking dogs. Lord knows what they see out there. When it comes to prescriptive authority, like I said, that's limited. A legal prescription has to contain the information found on pages 15 and 16. It may require additional instructions, sometimes over the telephone. If the healthcare provider has not written a prescription or an order, it can be given verbally from healthcare provider to the nurse or over the telephone. And when we write down an order given by a healthcare provider, we need to indicate if that order was verified. So we take an order over the phone and we say, can I read that back to you and make sure I have it right? Then you'll read it off. When the healthcare provider verifies it, we're going to write something down like VORBV, verbal order read back and verified, or TORBV, telephone order read back and verified. That's all going to vary with your facility protocol.